Good day, viewers. Welcome to a brand new episode of Week Clinic. In the clinic today, we'll be having Dr. Ezekiel Nwakpa, a public health specialist. The topic will be sexual transmitted disease, STD. Dr. Ezekiel Nwakpa will be telling us what are STDs, what are the common types of STDs. Thank you.
Good day, viewers. My name is Nwakpa Ezekiel. It's my pleasure to be with us today. Thank you.
Okay, the first question I'll be asking you today. So, what are STDs?
Okay, so basically, STDs is an abbreviation that stands for sexually transmitted disease. It can also be used interchangeably with STI, which is sexually transmitted infection. So this is a group of infection that is being transmitted through sexual contact. That is, these infections are only contracted by the mode of sexual activity. So basically, these are what STDs stands for.
So, what are the commonest STDs around?
Okay, so the commonest STDs that we have in our environment includes the HIV, which is human immunodeficiency virus. We have the hepatitis, basically hepatitis B and C. These are the common infections that can get through sexual transmission. We only have gonorrhea, we have syphilis, we have herpes simplex virus, we have human papilloma virus, and then we also have trichomoniasis. So these are the common STDs or STIs we have in our environment.
Thank you, doctor, for that. So, how can individuals protect themselves from contracting STDs?
Okay, so like I said from the beginning, that STDs are sexually transmitted infections. So basically, if you want to protect yourself, is by protecting yourself from sexual activity. So the first thing is to have limited sexual partners. By that I mean you reduce multiple sexual partners. That is one. Two, protected sexual activity by use of condom. And use of condom should be an effective and consistent use of condom. Also, by ensuring that you also do not use alcohol or drugs before engaging in any sexual activities. Because once you are under influence of drug and alcohol, occasionally you may not want to adhere to sexual protection. And also being aware of informations around sex and protection. These are one of the ways you can protect yourself from sexual transmitted infection. And also abstaining from sex, of course, is already a way of protecting yourself from sexual transmission, because if you are not having any sexual activity or you are not sexually active, then it's expected that you don't contract any sexual transmission.
Okay, thank you, doctor, for that. So, what are the commonest symptoms of STDs that viewers at home should be aware of?
Okay, so the commonest symptoms that you should look out for, one is painful urination. Though painful urination can speak to any of these infections, but painful urination is one of the signs. Abnormal vaginal discharge. So I use the word abnormal vaginal discharge because there are some other discharge that will also speak for that. So abnormal vaginal discharge, vaginal itching, rashes around the genitals, be around the vagina. It will also be around the penile area. Also some abnormal growths around the genital areas. So these are the common signs or symptoms you may see, and then you start thinking of sexual transmitted disease.
Okay, doctor, well done and thank you very much. So please, can we use by these symptoms, and maybe for the first commonest STDs, we can use maybe by the symptom, just like gonorrhea. This is the cause of gonorrhea. So our viewers can know that when I have this, it's most likely to be this. Can we have that symptoms and the common STDs? Which of them?
Yes, so like I said, painful urination is usually one of the clear symptoms suggestive of gonorrhea, both in male and in female. However, it's commoner in male. So if as a male you are urinating, it's not expected to be painful. So if you start feeling any pain, it's a sign that is pointing towards gonorrhea. Also, when you have milky discharge from the urethra, it's also one of the signs of gonorrhea in males. Then when you start having things like foul-smelling vaginal discharge in women, so it's a symptom pointing towards trichomoniasis. Then also, if you have watery, fishy smelling discharge, it's also a sign that is pointing towards vaginal discharge, gonorrhea in women. Then also when you have rashes around the genitals, it's pointing towards herpes simplex, which could also both in male and in female. So these are common signs, and you can see, even without testing, you can make a diagnosis of sexual transmitted disease. Okay, so for fishy smelly discharge, it also is for vaginal vaginosis, which is usually what's called a history sign of sexually transmitted infection in females.
Can STDs be transmitted through non-sexual contact?
Yes, yes, some STDs can be transmitted through a non-sexual contact. Take for instance, human papilloma virus can be transmitted through close skin-to-skin contact. Also, herpes simplex can also be transmitted through skin contact, especially when there are sores or bruises around the genitals. Yes, so you can also transmit. Human papilloma virus can also be transmitted through oral contact with any of the genitals. You can also transmit that. HIV can be transmitted through sharing of sharps and also through blood or any other body fluid. So these are ways that one can also have this infection that are transmitted through sex. Also, what we call lice can also be transmitted through close contact with the genitals, especially from the hairs around the genitals, even though there are no sexual contact.
Thank you, Doc. So how do healthcare providers diagnose STDs?
Okay, so basically for us to make diagnosis of sexual transmitted disease, there are cohorts of events that need to take place. One is history. So from the history, like I've said, there are some that are from the signs, you are already suggesting that it could be this type of infection. So when you ask questions around the symptoms the person is presenting with, so it's one of the ways you can make this diagnosis. The other one is examination. So after asking questions, you tend to examine, and there are things you are looking out for that will suggest some of this infection. Then you now go into some laboratory tests, and these tests can be done with use of blood, you can use urine, and then you can use some other body fluids or even wounds around the genitals. But I don't want to speak to the specific because that may take our time.
Thank you, Doc. So please, can you describe the treatment options available for these common STIs?
Okay, so for the common STI, especially for the ones caused by bacteria, the treatment option is usually use of antibiotics. It can be given intravenously. Intravenous means you are pushing it through the vein. It can be given intramuscular, means you are giving it on the muscles, and it can also be taken orally, means you are taking it through your mouth. So any of these STIs or STDs that are caused by bacteria, you are treating them using antibiotics. For the ones that are caused by viruses, you are giving antiviral drugs. Take for instance, your hepatitis, your HIV, then you give antiviral. So these are the common ones that we treat around in the environment.
Thank you. So what are the prevention measures and control of STDs in Nigeria?
Okay, so for us to prevent against sexually transmitted disease, the first one is abstinence. When you abstain from sex, you are actually preventing yourself from sexually transmitted disease. The second one is having protected sexual activity. So if you must have sex, then please use condom. The other means of prevention include limiting multiple sexual partners. Though you might contract infection by having one single partner if you're not protecting yourself, but when you have limited number of sexual partners, you're also protecting yourself. Then there are use of some other drugs that we've called pre-exposure prophylaxis, that is PrEP. When you use this drug also protects you from contracting sexually transmitted infection. So these are basically ways you can prevent yourself. And of course, you cannot overemphasize the place of health education. So when you have communication with your sexual partner, then you are also in a way protecting yourself from sexually transmitted infection.
All right, thank you, Doc. So what are the long-term health risks associated with untreated STDs?
Okay, so for untreated STDs, some of the long-term complications include pelvic inflammatory disease, especially in women. And this means this infection has lasted for long, affecting the female reproductive system. And this could also lead to infertility. For males, you could have what we call epididymitis or epididymorchitis, means infection or inflammation of the male genital tract, which is part of the tract that leads to the production of sperm in male. So this could also lead to infertility also in male. So in the long run, when you're having damages of all these your sexual organs or the reproductive system, then infertility may come in the long run.
All right, thank you, Doc, for that detailed explanation. So, how effective are condoms in prevention of the transmission of STDs?
Okay, so condom is very effective in the protection of sexual transmitted disease. However, it is not 100%. Say for instance, for HIV prevention, condom is about 98% protective for HIV. For some other bacterial infections like gonorrhea, syphilis is about 97 to 98% protective for it. But for infections like human papilloma virus, herpes syphilis, ones I've mentioned where you have contact with body fluids and skin to skin, so you can actually contact some of this infection if the condom does not really cover those areas. But in general, condom is effective in protecting against sexually transmitted infection.
And what about for HIV?
So for HIV, about 98%, condom can actually protect.
All right, thank you. So, what role does sexual education play in prevention of STDs?
Okay, so sexual education plays a whole lot of important roles in preventing sexual transmission, because when you know your health and know your sexual rights, you can protect against a whole lot of things. The first thing is knowing your reproductive system, knowing your sexual health, knowing if you have any infection, and then you can have communication with your sexual partner. Also sexual education also helps in awareness creation and in you going out to have regular testing. And when you test regularly, you will know whether you have this infection or not, and you are able to treat yourself. And equally, when you have this information, you are able to treat yourself and also inform your sexual partner to also carry out tests and screening for most of these sexually transmitted infections. So yes, sexual information and awareness is important in protecting against sexual.
So, thank you, Doctor. So, what is the impact of the rise of online dating has had on the spread of STDs?
Okay, so online dating, especially the use of things, spaces like Tinder, Grindr, has opened up more spaces for people to connect. Despite the fact that it also has its advantages, where people are openly talk about sex, sexual rights, reproductive health, but it has also made people to connect. And the more people are connecting with each other, the more they are exposed to sexual activity, okay, without the use of protection. So most times people through some of these social media spaces that I've mentioned connect, and then they hang out, meet in parties. I know in such places you are not even prepared to have sex, okay? And then when this activity takes place, most people do not have the luxury of having protection. So yes, social media spaces has increased sexual activity and people awareness towards sex.
All right, thank you very much. Can you address the importance of open communication between partners regarding sexual health and STDs?
Right, so open communication, like I mentioned earlier, improve sexual health. How do I mean? For sexual partners, when they are open to each other and they are able to talk around issues surrounding sex and their reproductive health, so they are able to share their sexual concerns. If a man has gonorrhea and he has good sexual communication with the partner, he can openly tell the partner that he's having these signs and he feels he's possibly having any of the sexually transmitted disease, and then the partner will provide those supports for him to treat, and the partner also gets to test. But when they don't have this communication, the man is trying to treat privately and secretly, then also exposing the partner to contacting this sex, knowing fully well that during treatment, you're also expected to abstain from sex while you are treating. And also in the case of HIV, if a man or a woman has HIV and you are not able to communicate with your partner, it means whatever treatments you are taking and all those supports, you are not able to get it. So when you have this communication, you are able to share your concerns with your sexual partner. Okay, Okay, so some of the misconceptions we have surrounding sexual transmission include one is that you can only have STDs when you have multiple sexual partners, which is wrong. With the misconception, you can actually have just one sexual partner and you will contact sexual transmission, especially if you're having unprotected sex. Other misconceptions include that you cannot contact STDs by oral sex, which is wrong. You can contact human papillomavirus, herpes simplex by oral sex. Other misconceptions include that most of the STDs that you can see them by mere looking at someone, which is not true. Mere looking at me, you cannot determine if I have any of the sexual transmitted infection. Then other misconception include some STDs not showing any signs, or most STDs should show signs, which is also a misconception, because you can have things like HIV, which you cannot actually see by looking at anybody. Even gonorrhea, like I said, even though it has signs, but occasionally you may not notice that anybody has gonorrhea. Things like syphilis may not even give any sign at the initial phases. So these are misconceptions that people have surrounding sexual transmitted disease.
All right, thank you, doctor. How do you address the challenge of informing adolescents about STDs in a way that they understand?
Okay, so for adolescents, which basically these are young people in their early stage, it is important that we discuss sexual rights and reproductive health for adolescents, especially in the young transformative stage, especially those in the early secondary school phase, like the junior secondary school phase. So it's important you discuss issues around sex. It's important you discuss issues around being open when they are in any sexual relationship. It's also important that you discuss issues around some of these signs of sexually transmitted disease that we've mentioned. It's important that you have this communication with them using the language they understand. There are various languages that adolescents understand now, especially for the stages we call the Gen Z. So there are some of these signs and the vocabularies that they understand. So discussing sex in these phases are important for adolescents to understand sexual rights and reproductive health. By doing this, they are open to communicate issues around their sex with you, and then you will know when they are at risk of contracting sexually transmitted disease.
Thank you, Dr. Ezekiel. So can you give us your last words?
Okay, so my closing remark would be that sexually transmitted disease cannot be overemphasized, and it is important that as sexually active adolescents and adults that will discuss issues around sex, it's important that you check yourself regularly, especially every 3 months. Conduct regular check on yourself, and then when you have any sign that is suggestive of any sex, please kindly see your doctor and get treatment. Thank you.
Subscribe to my channel.